Hey guys, so unfortunately it's Monday, and Monday came with an injury in the office already. So I saw a dancer for an ankle sprain injury, and that one hit close to home for me because I had 9 ankle sprains throughout my life and dance career, and it did put me out for a little while as well. So back dancing with the Cleveland Dance Project now, and you can catch our show next weekend if you're interested. But that's a whole nother Facebook page to go look up. In the meantime, I wanted to give you some information about ankle sprains. Can chiropractors treat ankle sprains? What are the best, most important things to do when you first get one? And just give you a little bit of information. So I actually wrote a 30-page literature review on this same topic while I was in school, so I'm a bit of a sub-expert, kind of selfishly at first because I wanted to get better. And then after that, I just wanted to be able to help others get better because I know it can mean an awful lot for a dancer or an athlete to be out of activity for any kind of length of time. So the goal with this particular method I'm going to discuss is return to play, get back to your activity, get back to class, get your range of motion back, get that beautiful point back, get that proprioception and sense of balance back ASAP. So that's what I'm going to talk about. If you are here listening, wave, say hi, tag a friend who you know might need to hear this, leave a comment. I'd love to hear from you. So the first important thing when you sprain your ankle, obviously, is going to be clear for a fracture. Make sure it's not fractured. Get it checked out. This is not something that's hard to determine, but you're going to want to have somebody look at it for sure. So yes, your first stop can be a chiropractic office because we are able to diagnose this might be a fracture and or it might not. We're able to, in many cases, x-ray or refer for an x-ray. And then the next step, if it is not fractured, is to get that injury graded, ideally by ultrasound, diagnostic ultrasound. So they're going to roll over the area. They're going to tell you you're either grade 1, which is the best case scenario. You're going to be swollen, you're going to be bruised, you're going to be hurting, but there's no tear. 2 is going to be a partial tear, and 3 is going to be a full tear. So those are the different grades. Important for your rehabilitation and what to expect and how you're going to maybe how close to 100% you're going to get after the injury, but also not necessarily crucial that you do this within like the first 48, 72 hours or anything. I am actually a big fan of letting the body's sort of innate intelligence take over. So the body knows, why do we swell after injuries? When we hurt something, it gets so big and swollen and bruised. So that's because fluid and blood are accumulating in that area for a reason, because bad waste products from the area need to go away and new nutrients need to come to that area. So for the first 24, maybe 48, 72 hours, depending on how bad the swelling is, I kind of tend to let it swell a little bit. Don't let it get out of hand, but I kind of let it do its own thing a little bit. After that, though, one of the most important things for returning to your activity as quickly as possible is to get the swelling out. So you can get the swelling out by a chiropractor who does manual therapies to work on the area. You can use kinesio tape to do this. A chiropractor can tape you for that. Or you can use things like laser therapy or ultrasound therapy to get the swelling out of the area. Another thing I like to do is just wrap for compression, right? That's the good old rice technique. Rest it, ice it, compress it, wrap it in an ace bandage, and elevate it to get the swelling out and get it towards your head. It's important that you could do that right away, but you don't have to just sit and let it swell. But if you let it swell for a very small period of time, sometimes I think that's just the body's natural way of managing things. Then you need to get the swelling out immediately. And the reason why is because, imagine if Even just in my thumb joint, I just added a whole bunch of puffy water. You can't move, right? You lose that range of motion. So that's why you feel like you can't move your ankle. It's because that swelling is just tightening up the area and keeping it from being able to flex your foot all the way. These are dancer terms. Flex your foot all the way, point your foot all the way. Plantar flex, dorsiflex. So you also want to get started walking right away. And if you can put pressure on it at all, you want to start to try to work through that natural gait pattern. Strike the ground with your heel, roll through the foot, push off of your toes. That's going to be very important to start walking and getting that moving right away. The longer you wait, that old like just let it sit there and wait for it to get better thing is no longer. The newest literature says that the sooner you get the range of motion back and the sooner you start moving, the absolute best case scenario for your rehabilitation. It's important to get the foot checked for alignment issues, which could have led to the sprain in the first place. So there are like, oh gosh, I don't know the number off the top of my head, but like 20 some bones in your foot alone. You need to be able to get all of those moving, have a chiropractor check your foot, and make sure that everything is adjusted and moving well. Probably from whatever happened leading up to the injury or the injury itself, your pelvis is out of balance and your low back is off too. That's going to affect how you heal and rehabilitate yourself as well. So get adjusted immediately, get that range of motion back in, start walking as normal of a gait pattern as you can, try not to baby it. And then for the rehab process itself, it's best to use something that's going to help you get your proprioception back or your sense of balance back quicker or sooner. In our office, we have a vibration platform for that. So you're going to stand on it. You're going to do these exercises, these rehab exercises, but you're going to do them while on a vibration plate, which is going to give you like 30 times the neurological input when you're doing these training exercises. So it's like you're doing a whole lot more exercises than you're doing neurologically, which is going to be very important for preventing future injuries. One last tip is that eccentric contractions, or that's contractions with gravity, are going to be one of the best ways to rehabilitate this area. So if you're a dancer and you're watching, think releve. So releve is going to be rising up onto your toes from a standing position. So pushing up onto your toes like a heel raise is what other athletes would call that. So rising up is, yeah, important, but that's against gravity, right? Rising up is one part. The part that's going to be most important for rehabilitation is lowering slowly down. So you're going to lift your heels up, lower slowly down with control. That is going to be one of the best exercises that you can do to start to rehabilitate that area and get everything back to 100%. All right, guys, that was a quick, detailed lesson on ankle sprain rehabilitation and treatment. I'm happy to answer any questions, and if you need assistance with any of this, just give us a call. We'd be happy to help. Have a great day.